Okay, have you ever heard that high pressure can cause the reversal of anesthesia? Let me guess. I think you will have never heard about this. So, a hyperbaric pressure, it means a pressure that is higher than the normal atmospheric pressure, can reverse or counteract the anesthetic effect. So there is a theory on it that hyperbaric pressure causes the anesthetic molecule to be displaced from the lipid bilayer membrane to which they are attached. So with the displacement of the drug, of the anesthetic agent, it causes the reversal of its anesthetic effect. So here we have the lipid bilayer theory. According to this theory, anesthetic agent attached to the lipid bilayer membrane, which they cause the disorder of the cell membrane, or I would say the fluidization or a conformational changes in the structure of lipid bilayer membrane, which lead to unconsciousness at the molecular level. This is according to the lipid bilayer theory, the mechanism of action of anesthetic agent. Okay, so what hyperbaric pressure do, that they reverse the anesthetic effect by physically displacing anesthetic agent from their molecular site. So let's suppose that anesthetic agent causes anesthetic effect, I mean putting a patient into a sleep, or causing a sleep mode on, by how, by what mechanism? By attaching itself to the lipid bilayer membrane. So think of pressure that it squeezes the membrane. Okay, it tightens the membrane, so it displaces the anesthetic agent from it. So the disorder that was caused due to the attachment of the anesthetic agent, it has been reversed now. So experimental evidence could be seen in many studies. There was studies done in lobster, in which it was observed that synaptic depression is caused by not only by pentobarbital, which was used as an IV anesthetic, but also by the pressure, high pressure, high pressure, and pentobarbital had, an additive effect, which causes both the depression of the excitatory synaptic transmission. So it means that it wasn't the key role, it wasn't the key player in facilitating the reversal of the anesthetic effect. And there are other studies which says that membrane disorder, there is a potential membrane disorder reversal. The membrane is disorder which is caused by, that we talked before, that it is caused by the attachment of the anesthetic agent. So what the hyperbaric pressure do, that it reverses the disorder. Okay, but some species also posits that this is only specific, this is a species specific. It means that it is not universal. The hyperbaric pressure is not also not a constant. I would say that it is not some value that I would say that, for example, 5 atmospheric pressure causes 10 atmospheric specific pressure causes the reversal of anesthetic effect. It isn't the case. Okay, so the study was done in lobster and some crustaceans, but there also a room for more studies in human. So the main implication of this theory is that it is provides an evidence, a groundwork for those theories that suggest that anesthetics act on the physical property of neuromembrane, okay, despite of its chemical property. So like lipid bilayer theory, critical volume hypothesis, fluidization theory, okay. So it is provide a support or provide a groundwork for these kind of theories. So there is still research remain to be done in this field, but it is a novel, I would say, a perspective, a fresh angle that one could see it a I would say non-pharmacological way of inducing unconsciousness, and there are very much less, I would say, knowledge about the unconsciousness, how unconsciousness uh, can be induces in a patient. I would say that 99% of most anesthetists don't know about it. They have only studied that anesthetic work by inducing unconsciousness, reducing unconsciousness in a patient, but they don't know how the unconsciousness is induced in the state of unconsciousness. So we will talk about that in some other video. Stay tuned and like and subscribe if you find it insightful. Thank you.